Healthy living begins with the choices one makes. Choosing to live healthy is the first step to healthy living. Join us Sundays 1:30 to 2 p.m. for Healthway, awareness for healthy choices.
Working mother, in as much I did express, but before I would get home it will be late and they'll just feed the baby with formula. But once I exclusively failed, I saw a lot of benefits. Yes, right from when I was doing it.
Hello and welcome to this week's edition of Healthway. Healthway is a 30-minute program that is designed to keep you health conscious to ensure that you stay healthy. I am your host. My name is Marie Joseph. Welcome to the show.
This is Healthway to help you make informed choices.
My name is Joy Onwoka Obase. I'm working in Patient Hospital, a private hospital in Lagos. I'm a health educationist. It has given me this opportunity to see parents and to educate them. I actually did exclusive breastfeeding with my second child, but the first one I didn't do it because as then I was a working mother. In as much I did express, but before I would get home it will be late and they'll just feed the baby with formula. But once I exclusively failed, I saw a lot of benefits. Yes, right from when I was doing it. First, it reduced the chances of my baby getting diseases that affected a lot of children then that were not exclusively breastfed, such as pneumonia, diarrhea, allergies, malnutrition. Even when she has grown up, being among other children, when there is a kind of disease has spread, she don't easily catch it. But the other ones that were not exclusively breastfed, they immediately contact such diseases. So that is what I experienced. It contained the required nutrients that the baby needed at the right temperature and also the antibodies that help the baby to fight against such diseases. And it's easily digested. That's what I noticed. There was nothing like constipation that's experienced during the ones I was not exclusively breastfed. So in a large scale, breastfeeding decreases the infant mortality rate when it comes to illness that can actually lead to the child's death. So when you properly breastfeed your baby, the baby is free. That is what I noticed also. And it was economical because I did not bother to spend money buying formulas, which are expensive now. So it's actually kind of economical for me to be able to cope. The first milk I gave the baby has color, that contains colostrum, and that may cleanse the stomach of the baby, promoting a good and better health, and there's no need for giving the baby medication. Then as for me, I use that as a birth control because it delays fertility. Since during that period I'm giving the baby, between that period I did not get pregnant even without taking any contraceptive, and it also created a good bonding between my baby and me. Every time they tell me, "Mommy, I love you," every time they was close, so it creates a kind of bonding, especially when I'm breastfeeding the baby. I hold the baby the proper way, she's sucking, she's looking at my eye, and the heartbeat, she's hearing it, which actually led to a kind of good mental or brain development for the baby. I actually saw the benefit of exclusively breastfeeding baby, and I encourage all parents to do that because it will help the child to develop immunity and in future to fight against some diseases that other people might not be able to resist. So it's very, very important.
Breast milk, they say, is the first and most essential source of nutrition for infants and newborns. But according to the latest National Demographic and Health Survey, the rate of exclusive breastfeeding in Nigeria is about 28.7%, and that means that over 71% of babies from 0 to 6 months are not enjoying the unique benefits of breast milk. But what does this mean to our Nigerian population and our growing children? But before we get into the discussion, let us take a break and take out the latest stories from our news desk. In our news this week, the Nigerian Center for Disease Control (NCDC) has reported that COVID-19 infections have risen by 231.5% within 1 month in the country. According to the center's epidemiology data, it shows that from May 28 to June 29, a total number of 1,262 cases were reported. It further shows that from June 30th to August 1st, the cases took a new surge as 4,183 cases were reported, indicating an increase of 2,921 by 231.5%. The country now has 261,473 total confirmed cases of COVID-19, with about 3,147 deaths. The total recoveries in the country have now increased to about 254,953. Meanwhile, the federal government said it has enrolled about 1,042,890 indigent Nigerians into the Basic Healthcare Provision Fund. The federal government, however, said only 753,999 Nigerians in 24 states can access free care. The Minister of Health, Dr. Nne Eka, disclosed this on Thursday at the quarterly Ministerial Oversight Committee meeting of the BHCPF held in Abuja. The BHCPF is enshrined in the National Health Act of 2014 to improve the national health indices and achieve universal health coverage. The BHCPF comprises 1% of the federal government's Consolidated Revenue Fund and additional contributions from other funding sources. It is designed to support the effective delivery of primary healthcare services, provisions of a basic minimum package of health services, and emergency medical treatment to all Nigerians. Speaking during the event, Dr. Nne said since the launch of the fund in January 2019, the federal government has released a total of 89 billion naira to the fund, and of this amount, a total of 56 billion naira has been disbursed to all the 36 states and FCT. Back home, Akwa Ibom State government, in collaboration with USAID-funded projects in the state, Breakthrough Action Nigeria, BAN, have urged religious leaders, which include pastors and imams, to encourage their members to access medical services when sick and not to keep them in churches or mosques. The Commissioner for Health, Professor Augustine Omo, gave the advice in his keynote address presented at the two-day training organized in conjunction with BAN for religious leaders on priority practice behaviors in malaria, tuberculosis and COVID-19 held in Uyo. The call became necessary following the rising cases of avoidable deaths due to failure of patients to get medical attention in time, as most of them run to their pastors and imams for prayers instead of going to the hospital for proper tests and treatments. Umo said, considering the influence these religious leaders, especially pastors and imams, wield on their followers, they should use it to change people's health-related social behaviors and strengthen community participation during the pandemic and emergencies. And that has been the news.
This is Health Way to help you make informed choices.
Welcome back. It's still the program Healthway, and this program is designed to keep your consciousness alert on issues as it concerns your health. Today we went on the streets of Uyo to find out how long nursing mothers on an average should breastfeed their child, and this is what they had to say.
Medically, it is suggested that a mom should breastfeed the baby for over 6 months plus, after which that baby can start eating some kind of solid food, like not like solid, but something close to being solid. But basically breast milk and water like for 6 months, because the breast milk contains so much calcium, phosphorus, what have you, to make the baby strong, agile, smart, and every single thing. Though there are exceptions, there are miracles, but medically, ideally, that is what has been approved. 6 months max.
I did exclusive for 6 months, though it was very hard from the beginning, because at first, when I gave birth to my baby, for like 3 days, the breast milk did not flow. That is supplement with water and I think glucose. And then after the 3rd day, the breast milk started flowing, and it was too much, but I really had to endure it. At the point, I tried giving him baby food, I think when he was 4 to 5 months, and he rejected everything, just the breast milk. So I had to continue and endure for 6 months straight doing exclusive. And then after 6 months, we started incorporating baby food, akamo, Tom Brown, and all those small things into his daily meals. And then we started giving him okra soup. Started with okra soup and curry, like that. I kept on breastfeeding him till he was 1 year. Exactly that day that made him 1 year. I stopped. So I was like withdrawing a little bit from 3 days to the day that would make him 1 year. So when I came back to my son, I heard a lot of things. Like I had heard that a child was supposed to be breastfed for 3 years to allow the mother and child to bond properly. I won't lie, I did not see myself doing something like that at all. Some people actually still breastfeed their child even after the child has started school. Child will go to school, come back and still suck the breast. While I also heard that some mothers use it as a form of birth control. I don't know, I'm not sure. But I just did it for 1 year and stopped immediately. It was 1 year.
As a mother, I breastfed my children for 4 good months. No water, no food. Mostly in the night without anything. And the baby complete 4 months, I'll start giving them cereal mixed with the tin milk. Then I now breastfeed them in the night throughout with breast milk. Though most of my children don't suck much, but those girls, I cannot forget them. Those girls suck past the boys.
Those were the views gotten from the streets. Some said 4 months, others said 1 year. But what is the importance, or should I say the extra benefits, for children who are exclusively breastfed for 6 months as the stipulated time given by the World Health Organization? You would also ask, what are indeed the deficiencies or what's lacking in a child who is not properly breastfed? To further throw more light on this issue, we have a public health physician who works with the University of Uyo Teaching Hospital, and she's also a member of the Association of Public Health Physicians of Nigeria, Akwa Ibom State Chapter, Dr. Nne Eka Esubok. It's good to have you join me on the program.
Good afternoon, listeners at home.
We all know that breastfeeding is important to the development of a child, but dedicating the entire week to commemorate breastfeeding, why is it important?
Okay, it's very important that a whole week should be dedicated to breastfeeding globally, and the theme being Step Up for Breastfeeding, Educate and Support Breastfeeding. It's important because we are not doing what we are expected to do. Statistics by WHO has shown that only 29% of babies in Nigeria are exclusively breastfed. The remaining 71% are not. So we're not doing enough. And children, if they are not adequately breastfed, this could affect their future, their ability to grow and develop the way they should. Sensitizing and getting the populace aware of the benefits of exclusive breastfeeding and the need to support the women as they breastfeed their children after delivery.
Why should women breastfeed?
Like I said, women need to breastfeed because it is important. Okay, it has a lot of benefits, both for the babies, the mothers, the family as a whole, for the community and the nation at large. The benefits of breastfeeding to the baby: one, it ensures that the baby gets the right nutrition. The breast milk contains all the nutrients, antibodies, and enough water for the baby. 80%, some mothers will say, the breast milk is not enough. The baby keeps crying after suckling, that they need to add water to the baby. Well, for your information, 80% of the breast milk is water. What water again do we need to add? We don't need to add any other water. 20% contains the nutrition, the antibodies, and all the macro and micro elements that the child needs to grow, for their brains to develop and make them strong as they should be. So we don't need any other additive. Giving the child exclusive breastfeeding reduces the risk of that child coming down with infection. How does this happen? The breast milk has been prepared in the right temperature, constituents wise, and the right volume as a child can take, okay? And that is sufficient for the baby. Now, there is no form of contaminants in the breast milk. All the mother needs to do is clean the breast, the nipples properly, and then place the child in a comfortable position, and the child suckles and get 30 minutes on the left side, 30 minutes on the right side, getting enough milk, and the baby is okay. Compared to preparing infant formula, in the process of preparing this infant formula, the contaminants may come from the milk itself if it is expired, it may come from the cooking utensils like the kettle or the cups or the feeding bottle, which a lot of women are still using despite counseling that they should desist from the use of feeding bottles. Now, those feeding bottles are a source of contamination for the baby, because the teeth of that feeding bottle, or even the feeding bottle itself, if not properly washed, if not properly sterilized, okay, can be a source of infection to the child's feed. And when the child takes it, the child begins to stool. So exclusively breastfeeding the baby reduces the chances of the child coming down with all this childhood-related diarrheas and illnesses, okay, that has to do with feeding. Providing the child with exclusive breastfeeding also ensures that the child receives all the calcium, the iron, okay, like I said, micro and micro elements from the breast. The child will get it in the course of exclusive breastfeeding. Now, it's also, statistics have shown that children that are exclusively breastfed, they have high intelligent quotient. They tend to be very intelligent. They can relate with their environment as compared with children who are fed with infant formula or cow milk. So these are the benefits for the child. Then it reduces the risk of the child coming down with health issues or health conditions like obesity in the future, diabetes, and asthma. So a child who receives the breast milk may likely not have those problems compared with a child who takes infant formula. Now, some children do not tolerate infant formula. Some have lactose intolerance, okay? But the breast milk, the baby is able to digest it without any problem. The breast milk does not give the baby, cause him to fat excessively. But some of these infant formulas, children react to them and they begin to produce gas excessively from their stomach or accumulate gas in their stomach, and you see them fatting. And the mothers will be complaining that the child appears as if he has excess gas in his stomach, all because the child is reacting to the infant formula. Okay, so these are the benefits. There are a lot more benefits to the baby. Now, the benefits to the mother. A mother who breastfeeds her child exclusively reduces the risk of having breast engorgement, mastitis, and breast cancer in the future. Reduces her chances of coming down with breast cancer and ovarian cancer. How does it do this? As the woman breastfeeds, that reduces the breast engorgement the woman experiences as she begins to breastfeed. Now, as she breastfeeds, this causes the prolactin, the hormone responsible for breast production, to increase and causes the hormones responsible for the enlargement of the ovaries, such as the luteinizing and follicle stimulating hormones, to recede. So as she breastfeeds, and those are the hormones that if it gets out of proportion or gets derailed, can tip the woman to ovarian cancer. So breastfeeding reduces that risk for the woman. All right. Breastfeeding allows the mother and the baby to bond together effectively. In the course of putting the baby to breast, the baby receives warmth from the mother, and that keeps the child growing, stronger and healthier. It enables the baby to identify the mother's body odor, and that's why you find out a lot of babies, once a baby is given to a stranger, the baby can be able to distinguish between his mother and a stranger, because the baby has gotten used to the mother's body odor, and that can only take place in the course of breastfeeding the child. That closeness, okay, is established. Okay, so the mother knows his child. Breastfeeding also serves as a form of contraception for the woman. Contraception in the sense that a lot of women during the breastfeeding period, it doesn't allow their menses to start again, so prevents them from taking in. Those who do it effectively, a lot of statistics have shown that. Okay, so a woman who does not breastfeed effectively or exclusively stands the chances of taking in because she's not doing it well. So those are the few benefits for now I can remember, but as I remember more, I'll let you know. Now, the benefits of exclusive breastfeeding for the man, it saves the man a lot of money. That 6 months the mother is going to exclusively breastfeed, the man can be able to save or put away the monies. Now, the cost of a can of infant formula is about 5,000 plus, or maybe depending on the type, within 4,000 to 5,000. And a child that is on infant formula will consume a can within 2 to 3 days. 2 times a week, buying infant formula, that saves about 10,000 naira. Times 4, that's 40,000 naira in a month. Okay, so for the 6 months, the man would have been able to save almost roughly 120,000. So if we look at it in this light, it gives the man the opportunity to save a lot of money. The money he would have used to buy all those infant formula can be used, channeled into something else. So that's the benefit. And allows the man to also bond with the child. That period of breastfeeding, the man comes around, gives the wife the support she needs, carries the baby when the baby has slept after breastfeeding. That makes the family, bond better and makes everybody happy. So, and a family that is happy, mother healthy, baby healthy, it ripples out to the community. That means there will be peace in that community, and the babies will grow the way they're supposed to grow and be able to, mix and compete favorably with their counterpart in the community and in the society at large. So breastfeeding has a whole lot of benefits for everybody in the family and also in the community.
How long is breastfeeding actually beneficial?
So the baby that is to be breastfed exclusively for the first 6 months, from the time the mother delivers the baby, within 1 hour of delivery, the baby is expected to be put to breast as when the child needs it. Anytime the child needs the breast milk should be given without additives like water, herbal concoctions, or even infant formula. The baby should not be given pacifiers in place of breast milk. When the child starts crying, the child should be given the breast milk any time of the day the child needs it. That is exclusive breastfeeding, and this should be done for 6 months. Now, after 6 months, there's introduction of complementary feeds. That is, initially they can be started with the baby can be started on infant milk, while the baby is still breastfeeding as well, because by 6 months the breast is no longer sufficient for the child. The child is growing, the stomach is enlarging, the child is more active than the child used to be, so the child needs more energy, more calories now. So this we can get by adding complementary feeds like guinea corn, yellow maize or white maize, fortified with soybean powder or palm oil for vitamin A, and crayfish, all to make the food balance, so that when the child eats it, the child gets the much needed nutrient from it, while the child is also still breastfeeding alongside. So the breastfeeding can continue for the child while the child starts eating household meals till 2 years old. That is what is recommended by WHO, and we think it will be good for every mother to do that. All right. So for mothers who after delivery they observe, who are career women, they're working, they take their maternity leave. Once at the expiration of the maternity leave, they're expected to still continue breastfeeding, exclusively breastfeeding their children. They can take the child along to their workplace, or they can put the child at a crèche close to them, or get some form of caregivers to support them while they resume work. So also for those who, incidentally, some women they take in the course after delivery, especially those who did not adopt any form of family planning. It doesn't still stop the mother from breastfeeding the child. The pregnancy does not affect the child in any way, but we have seen that in time past, those mothers, because of the pregnancy, it starts affecting them, the energy, the strength to still be breastfeeding. This causes a lot of women to stop breastfeeding abruptly before the time that is stipulated for them to stop. So we discourage this. We say pregnancy does not affect breastfeeding in any way, so they should continue to breastfeed their children. It will only make the child grow stronger and healthier.
So please tell us, what medical or psychological factor can impede a woman from breastfeeding?
So there are factors that may impede or serve as a barrier to effective exclusive breastfeeding of babies. Now we have the personal factors, which may be medical, or like you said, psychological. There's the social factor, cultural factors, depending on the cultural practices of the women. Take for instance, the woman is ill. She may not be in the right position to breastfeed that child exclusively because of her illness. So if such a woman is ill, she needs to seek medical attention to ensure that she's physically fit to continue breastfeeding. Now, if she has any psychological issues, maybe a personal thing, okay, or for in case of a woman with postpartum psychosis, that woman needs medical attention. If it has to do from the home front, maybe there's a dispute in the home between the husbands. Take for instance a couple who were expecting probably a male child and the woman delivers a female child. That may affect their communication. That may affect the stability of that woman, especially if the husband abandons her in the hospital, or for financial reason she's not able to pay her bills. These are things that may affect her psychologically, and that will affect our ability to produce breast milk optimally. Okay, so those are the personal factors. There are lots of other personal factors for time. Okay, so social factors. We look at myths in the community. Some say a woman who is breastfeeding cannot have sex. Okay, which is not true. Sex and breastfeeding, having sex does not debar the woman from exclusively breastfeeding her child. In fact, the sex makes the woman stable, puts her in a right frame of mind to be able to attend to the baby and exclusively breastfeed the baby. Okay, so a woman that is breastfeeding or breastfeeding affects pregnancy. It does not affect pregnancy in any way. And also a woman that stays away from the baby, that it causes the breast milk to sour. There's nothing like that. It doesn't cause the breast milk to sour. It's within the woman, so it cannot sour. Okay, it's only when it's out of the breast and probably not kept in the refrigerator, it can get sour. Okay, now for those who they express their breast milk, maybe career women, they have to express the milk down before they go to work. The breast milk is put in a container, well sealed, put in the refrigerator. When it's time for the baby to be fed, it's brought out, put in a bowl with hot water. The breast milk is put in it. Once it's warm, tested to see if the temperature is optimal for the baby, then the child can be breastfed. It can last 8 hours outside the breast, okay, if kept in a conducive, under conducive temperature. Okay, so the breast milk, if a mother going away from the child for a long time, does not affect the breast milk. The mother can breastfeed the child anytime the woman chooses to. So those are some of the myths. Okay, some people say, some culture say the man should be separated from the woman. So the nursing mother goes to stay with the mother-in-law and the man is away. Meanwhile, the woman needs the presence of the husband. Okay, these are some cultural practices that may have some negative impacts. The man being around the woman stabilizes the woman, helps the woman also to be happy. Okay, she has somebody. The man can give his support, even in carrying the baby, if there's nobody to help. So if she goes and stays away from the husband, the man too needs the woman's presence around to fulfill her marital obligations to him. That separation can cause a lot of problems later. The man can start going out because of his own needs not being met, okay, sleeping with other women. So these are practices, cultural practices that do not also favor exclusive breastfeeding. Okay, so we encourage that all women should receive the support they need from their husbands, from their relatives, from the community, both at the church and, the community level at large.
For mothers who have been tested positive for HIV, what are their options?
Okay, for mothers who have tested positive to HIV, in the developed countries, the options they have there, they are advised not to breastfeed. But for economical reasons here, financial constraints, for a lot of people in this low socioeconomic countries, we advocate that the mothers should breastfeed their babies, but under strict supervision and guidance as to what to do. A mother who is HIV positive is advised to breastfeed the child exclusively without adding any infant formula or any additives. Okay, that reduces the chances of ulcers within the alimentary tract, and it is those breach in the alimentary tract that can cause the virus to penetrate in the body of the child. Okay, so that is what happens. We counsel the mother to exclusively breastfeed, and when she is due to wean the baby off the breast milk, she does it abruptly without mixing the feeds, the breast milk and the infant formula. Now, the woman who has been HIV infected, before delivery and after delivery, she's placed on her medication. This reduces the viral load in that woman, making her less infective to the child. So the mother is placed on her medication before and after delivery, thereby reducing the viral load and the chances of the child getting infected. That's the option for the woman. However, for those who are financially buoyant and can afford it, meanwhile, one of the reasons why we also advocate that the woman should breastfeed is that, the breast milk contains antibodies and certain nutrients which may not, like the antibodies, may not be found in the infant formula. And the baby needs those antibodies to build his own immune system, the baby's own immune system. Okay, so that is why we advocate for those things. There is no substitute for the breast milk. The infant formula is not as rich as the breast milk in terms of providing that antibodies that the child needs to build his own immunity. So that is why we advocate that they should still go ahead and breastfeed. However, if the woman is able to afford the infant formula from the onset, she can, but readily will advise that the women will breastfeed because of the financial constraints most women complain of in the clinic. And another thing we see challenge for HIV mothers is the family support. Now, we advocate that in the hospital that mothers who are infected for any reason, they should disclose to their partners. We have cases of serodiscordant couples where the man does not have the HIV the woman has. Now, if the woman discloses her status to the husband, we counsel the man on the need to support the woman when she has put to bed in the terms of breastfeeding and all. Okay, so when the man is in the know that she's positive, it is easy for the man to support if they have the financial means to procure infant formula. He will support that, okay, go ahead, don't breastfeed, so that the chances of picking the HIV is highly reduced. Okay, so but when the man is not aware of her status, it becomes difficult for the woman. So she has to breastfeed because the relatives will come around, they start asking questions. Why are you not breastfeeding? And she doesn't have what to say. So that will cause a form of friction in the home. So disclosure is highly important, or makes it easy for the woman to exclusively breastfeed the child when she has put to bed, even with HIV infection.
And that's it on the program for today. I have been talking with Dr. Nne Eka Esubok. She is a public health physician working with the University of Uyo Teaching Hospital, and also she's a member of the Association of Public Health Physicians of Nigeria, Akwa Ibom State Chapter. And we were talking about the importance of exclusive breastfeeding, and she also talked about the nutritional benefits of breast milk and advised mothers to adequately feed their babies exclusively for the first period of 6 months, in which afterwards complementary foods can be introduced alongside breast milk for the period of 2 years and beyond, as this is crucial for the development of the child and reduces the chances of the child to being affected by infant killer disease.
This is Health Way, to help you make informed choices.
Well, join me next week, same time, same station, for another exciting episode of Health Way. I am Mary Joseph. Until we meet again, remember, HIV is real. Get tested. Know your status to gain control of your life.